I will now share the most current case counts. There are 87,508 confirmed cases of COVID-19 in Canada and 26,483 cases in Ontario. Chatham-Kent has 144 cases, and Sarnia-Lambton has reported 261 cases. Michigan now has 55,608 cases, with 10,872 cases being in Detroit. Today, we are reporting 927 cases of COVID-19 in our community, an increase of 7 cases from yesterday. All 7 people work in the agri-farm sector. 492 of our cases have resolved. 16 people are in hospital. 18% of our cases are between the ages of 20 and 29 years. 17% are between the ages of 30 and 39 years, and 17% of our cases are 80 years or older. 47% of our total cases are male, and 52% are female, with 1% unknown. Our community has lost a total of 63 people to COVID. 47 deaths have occurred among residents in long-term care and retirement homes. 2 long-term care and retirement homes are currently in COVID-19 outbreak, which our health unit is working with. Testing is available for symptomatic people, those who have at least one symptom of COVID-19, even mild symptoms, and testing is also available for asymptomatic people based on a level of risk, including people who are concerned that they have been exposed to COVID-19, people who are contacts of a confirmed case or may have been exposed to a confirmed case or a suspected case of COVID-19. Testing is also available for asymptomatic people who are at risk of exposure through their employment, such as essential workers, including healthcare workers, grocery store employees, and people working in food processing plants. No one who is symptomatic or who is concerned that they have been exposed to COVID-19 will be declined to test at the assessment center. Common symptoms include fever, a new or worsening cough, shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Also, the Southwest Aboriginal Health Access Center in Windsor offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at WECHU.org for the most current information and case counts. I just want to mention as well that we will be starting our random testing tomorrow in Windsor. People who attend must have a health card, and we will be providing more details at tomorrow's session. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning. Today, I, Teresa Marintet, and our other members of our leadership team at the Windsor-Essex County Health Unit will be joining the Windsor-Essex Regional Chamber of Commerce for our live webinar at 2:30 p.m. During this 1-hour webinar, the Windsor-Essex County Health Unit will provide a current overview of COVID-19 in our community and will officially launch the Safe Reopening Toolkit and resources. This is a first step in an ongoing conversation and strategy to support local businesses and workplaces to operate safely, mitigating risks related to COVID-19. As well, the Windsor-Essex County Health Unit will work with partners in the community to regularly provide resources and virtual education sessions covering key topics that address employee health and well-being. As part of the staged approach to reopen the province, the ministry has developed a number of sector-specific guidance documents. The Windsor-Essex County Health Unit work is intended to complement the work and simplify messages and directions for the local context. In collaboration with the BIAs and local chambers, we are committed to bring timely, credible, and responsive resources and information to the business community. Today's webinar will also feature a lengthy Q&A session during which participants can get on-the-spot guidance and support from public health officials. To register for the webinar, go to www.windsoressexchamber.org. I will end today with today's question from our Facebook Live viewer. The question relates to guidance for day camps. The viewer wants to know, when will public health guidance for day camps be available? This is a great question and aligns well with today's announcement. At this time, there is no provincial guidance document developed for day camps. The Windsor-Essex County Health Unit will work with local day camp providers prior to opening to review plans and ensure that all public health requirements are met. We're expecting that there may be some additional guidance from the province coming in the way. Until then, we are looking forward to connect with the individual day camp providers prior to their opening time and support them in ensuring a safe day camp services. Thank you.
Now start taking questions from the media.
We'll start with CBC.
Good morning. I know there were 7 new agri-farm workers. Were they from the same farms? Is it new farms? What's the situation?
I think these are the farms that we are already investigating, and there are a number of farms that we're currently working with, where we have all these.
Is there any outbreak? Are these from close contact? How are they getting it? Is it all because of the living situation, or is it the working situation? Have you figured it out?
Well, these new 7 cases, we still have to collect all the information before we can comment. But mostly, all these cases are in individuals who are close contact through their shared accommodation. But for these 7 cases, we'll have to collect additional data before I can comment further.
Okay. As for the random testing, is the plan to do it by ward in the city or just in populous places?
Just in popular places, recognizing that there are a lot of logistical challenges, traffic flow, and other issues that we have to consider. So we will not go ward by ward. It would be a location identified which we expect to see a lot of traffic, and hoping to provide that service to the community.
And I think you said about 1,000 to 1,500. Do you have that many tests available?
That's the plan. We've already talked to the lab, and they're aware of the plan, and we will have everything that's needed to get the test done for the city of Windsor. So we did the numbers again. For the city of Windsor, we roughly need 1,300 samples, but across the Windsor and Essex County, we are looking to get at least 2,300 to 2,400 samples in the entire region. The plan is to start from Windsor and then move out to the county with the hope that we have at least one session in each of the municipality.
Thank you.
Any questions from Blackbird?
Sorry, just to clarify those numbers, you said 1,300 in Windsor specifically, 2,300 to 2,400 in Essex County, or is that including the Windsor numbers?
That includes the Windsor number.
Okay. And that starts today?
It starts tomorrow.
Wow. Great, thank you.
Any questions from CTV?
Okay, so first, let's talk about the outbreaks in the LTC. So there's still 2 more homes, right? They were dropping like flies last week. You went from 18 to 16, now you have 2 left. How fast will we be able to clear up? Like, what's being done to clear those 2 up and get that out of the way and just be done with it?
So every time we have an outbreak, so when we are declaring an outbreak, there are a number of measures that we start to implement. The first thing is we try to set up an outbreak team in terms of what it looks like, what are the cases look like, what are the case definitions, and our team get in touch immediately with these homes to ensure that outbreak control measures are in place. And all these outbreak control measures are put in place to reduce transmission from one individual or one case to another case. The key strategy that we use is to isolate these people who are sick or symptomatic, either confirmed or even unconfirmed. But if they have symptoms, the idea is to you move them away from all the other people who do not have any symptoms. And in the same sense, ensuring that the staff who is providing care to these individuals are also separated. The ones who are caring for the sick people, they stay with the sick. The ones that are caring for the well people, they are staying with the well people. And there shouldn't be any cross movement of these workers around. Ensuring that when we are keeping all these individuals in one place, appropriate IPAC control measures are in place, ensuring appropriate use of PPE, appropriate use of hand washing, hand hygiene, and any other measures that is needed to limit the spread from one person to another. So all these conversations happens every day. And if all of these measures are put in place, the idea is you shouldn't have any new cases because that's how the disease is transmitted. Working with the homes, if any of these measures fail, then we have new case. So if a new case happens within the 14 days timeline, then we consider that it was possibly a result of an ongoing transmission in one facility. That's why the home continues to be in that outbreak mode until we clear all the cases and no new infection for the next 14 days from the onset of last person whenever they were identified. So until that happens, the home continues to be an outbreak. But unfortunately, in some cases, before the 14 days mark, a new case comes in, either in a staff or a resident, and then that way we go back to the beginning again. Okay, let's do it again, make sure that everything is in place. So it's hard to tell that when it will be all over, but the hope is we really enforce all these things, and some of the measures that we do is ensuring that the staff are following that. We put up some certain requirement restrictions on these homes to make some of those things happen. So all of those things are in place right now.
Okay.
Thank you for that. Also, just give me some more background on the webinar and the toolkits and the resources with is it the Economic Development Corporation?
Windsor-Essex Chamber of Commerce.
Chamber of Commerce, sorry, yeah. So is this preliminary with them? Is this, just to spark the conversation, or are we, are we actually going to go out into the community now and, they're going to handle these toolkits? How far along in that process are we?
So we were approached by the Windsor-Essex Chamber of Commerce to provide some guidance to their membership, and through them we identified that maybe a webinar type session with an opportunity for the membership to ask questions and some of the high-level guidelines of what it means for when we are talking about reopening. What are some of the things from a public health perspective that they can use to ensure that their businesses are safe and they are following the provincial requirements and guidelines. So that was the conversation, and then we felt that it's important for them and also for us to have some kind of a toolkit available that people can use and maybe just identify what are some of the things that they need to do to ensure that their businesses are ready. So all those conversations, and up until today, the hope is when we present that information, we'll start that dialogue, we'll start that conversation, and then moving forward, there are some specific industry or sector-specific guidance we are expecting from the ministry as well, which some of them are available. But then what we will do is we'll combine our toolkit, combine the sector-specific guidance, and then provide an opportunity for all of these businesses to connect with us to find to help them restart some of the work that they do. Obviously, I cannot say that we'll be talking to each of the businesses here, but at least sector-specific guidance or sector-specific conversation will happen, and it will be beneficial for them to be part of that conversation. And we want to make sure that we are available for with our expertise. We have tons of expertise with respect to our teams, including myself, our leadership team, our environmental health team, our infectious disease team. So we want to make sure that we are utilizing all of our resources to support our community in the best way possible.
Any questions from AM 800?
Yes. When was the last time we had 0 cases of community transmission? Agriculture, but that means 0 in the community.
I don't think that we had any day that with 0 community transmission. I think we recently started to provide that kind of breakdown, but and since we started, I'm not sure that if we had a 0 community transmission yet. But again, mind you, these people work in the agri industry. Doesn't necessarily mean that they acquired the disease either at the workplace or at the bunk bed. They could have acquired it in the community. But I don't have all the case details because we try to provide you with the most up-to-date number as early as possible. So you have the number, but some of these details we will be collecting information today, and will help us in better understanding from a case and contact management perspective.
So how are you feeling given that, okay, so in total we have 7 today, yesterday was 4, the day before was 4. More people are being tested now and more businesses are opening now. So are you feeling a little bit better now?
Well, I think I expressed my comments a week or two ago with respect to how the cases are progressing in our community. We had a relatively stable number of case counts, averaging somewhere between 8 to 10 cases a day, and then we had a significant spike over the weekend when we touched the maximum of 36 cases. But most of these cases were very specific to an industry. So that's again, it's something that I'm looking forward to, that if we can get some consistency and over a longer period of time, if we see this trend, that would definitely be encouraging. But I don't want to be too overly optimistic just looking at a few days data. I would like to see a trend. The trend was moving in the right direction, and I hope that it continues to go in the right direction.
Okay, thank you.
Any questions from Windsorite?
Yeah, you had mentioned the 2,300 to 2,400 tests for the random testing. Over what time frame would those be conducted?
So some of that is really dependent on the number of people showing up at those sites. Our hope is at least it may take us at least a week and a half to 2 weeks to get all those numbers done. But again, it's dependent on how many people end up in showing up to these drive-through testing sites.
Any questions from the Windsor Star?
Yes, I believe we haven't had a new death reported for almost 2 weeks now. It looks like the long-term care home cases are under control. So can you sort of comment on that correlation?
Absolutely, and I think that's a good thing from our perspective. Again, I don't want to jinx it, but I'm really happy to see that. We know from a risk perspective that individuals in the long-term care homes or people with older age and some comorbidities, they are at a higher risk of developing more severe outcomes, including death. So we are happy in that sense. But again, I don't want to jinx it. We like to keep it that way, and hopefully the community continues to stay safe and we continue to see less number of cases. That's the hope. But in order to achieve that, it's all of us, me, you, and everyone else, to do our part to continue to do what we are doing even in the face of reopening the economy, reopening the businesses. We all have our part, and we need to continue to play our part to keep the numbers same way. It's not about scaring people. It's not about telling them that you shouldn't do what it's legally allowed. It's just making sure that when you are outside, you are following all those recommendations and guidelines to ensure the safety and well-being of you, your family, your community, and everyone that lives in our region.
Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thank you.
CTV?
Yeah, just a quick one about the drive-in theater in Tilbury. I guess they want to open, and I guess they're just looking for an answer as to why it's not possible right now, considering people are in cars, they're separated, they're isolated, and it's just a big movie screen outside. So is that something that comes from the government, or is that something we could push here locally just to make something like that happen?
There are some restrictions directly coming from the province, which include any organized event, any organized activity, which I would see that this is an organized activity, organized event, which is not allowed under the current Emergency Management and Civil Protection Act. So it's not something that we can say that we can go ahead or make a decision based on what our issue is. So I think I'll have to wait for the ministry direction in that particular regard, hoping that as more and more businesses are opening up at the right right time, that would be the direction, and some of these directions will come from the ministry, and we'll have to then look at the local issue that how it will impact our community, and would that be a safe thing to continue on, and what does it look like? What are some of the restrictions or the processes that we need to ensure that everything is safe and everyone is safe?